One is on the patient side. And when we think about health and well-being as individuals, we only tend to focus on things that are symptomatic, things that actually manifest itself. And so we tend to be reactive in nature. And unless you are an individual that's motivated and wants to know everything about your health, you're not paying attention to what's happening before it becomes serious. And I think this then in itself presents its challenges to the healthcare professionals as well as the system in terms of how do we now really create a more proactive system versus a reactive system. And so a lot of the challenges on the healthcare professional side or on the system side tend to be either organizational design of how we've been set up as a healthcare system, or just barriers in terms of changing a legacy system. So I think in 10 years, we're definitely going to see more of artificial intelligence playing a key role as an enabler, being assistive in whether it's for a patient or a physician. I think there's going to be much more kind of convergence between treatments, whether they are medical devices or pharmaceuticals, and ultimately, the entire care team working, much more in an integrated manner. Yeah, I think today's session at the summit has been great. We've already heard conversations around how blockchain is playing a role in really kind of maintaining the trust in this distributed nature of health data that exists. So I definitely see more maturity on that coming to fruition. I also see artificial intelligence playing a role in that predictive nature, helping whether it's a patient or even the physician anticipate when something might surface, and then being able to equip the team to really take care ahead of a critical issue or an acute symptom that might manifest. The barriers that I see, and this is something that just in my experience in the industry, is it comes down to our willingness to collaborate together and really have a common goal or a common vision, and what is it that we're trying to address. And I think this takes a lot of work. I think it takes, it requires building trust. We've heard that today in terms of the need to come together in a room, and I think that's really what's slowing the pace of change. But I think one thing that can help us is we've got to keep that focus on the patient. Keeping the patient's health and outcome at the center, and all work as stakeholders in the healthcare system to drive that better outcome. Part of why we decided to participate in the Digital Health and Wellness Summit is twofold. One is you get to hear from other folks who have been implementing or trying new ways of using technology in delivering better care. But most importantly, also finding a way to connect with some great minds, finding ways to collaborate and make improvements in driving better outcomes on behalf of patients.